everyone. Welcome to News Extra, and today my guest is Paulette Schnell from Regional West Medical Center, the Community Health Director, and we are here to talk a little bit about the importance of some of these immunizations and some of these diseases that are, they're making a comeback.
Yeah, unfortunately, we see measles that was declared that it was completely gone in the United States back in 2000. It is back and hitting it heavy this year. We already have over 1,000 cases, and we only had 300 and some cases last year total in the United States. So we're 3 times more right now than what we had last year, and it's only been a half of a year.
Now, these have kind of been hitting areas that more on the East Coast, West Coast, southern states that you hear of. What's our situation here in Nebraska when it comes to these diseases that we thought we had them completely eradicated or at least under control?
Yeah. Well, measles, we've been very fortunate in Nebraska. We haven't had a case yet, but we do have states around us who have, Colorado being one of those. And mumps, we've already had a few cases this year in Nebraska, and we have some places around us, again, mainly Colorado, that has had those same diseases. And then we also have seen it come back with pertussis, which is whooping cough.
Yeah.
And we have, in the last several years, we've had cases in Scottsbluff County, anywhere from 2 to 5 cases a year, and that's something that you used to not think about having around either.
Is it just a lack of proper vaccinations among the population that's led to these comebacks? Are there any specific issues that have really driven this increase?
Well, we see some people, I think they haven't seen the diseases, like those people that maybe grew up when they were very common, and so they think that maybe they don't need to vaccinate against them because they just don't see them. Mm-hmm. But the reason why we don't see them is because people are vaccinated. And so by choosing not to vaccinate your children, you're putting not only your children and your family, but others around you at risk by bringing that back in a way that the whole group is not protected. So the other thing we see is international travel.
Yeah.
We do the travel shots at our office for anyone that's traveling out of the country, and we see people every week that are going someplace international. And plus, we have also a lot of international people coming into our area, and into United States. And so it's a big world, but it's small. And when it comes to travel anymore, so what is over across in Africa or Europe is going to be here because of the spread. And then just also, summertime, we're doing a lot of traveling, so Nebraska hasn't had any cases of measles yet, but I think it's a matter of time with all the travel, and we have one of the highest vaccination rates as far as states, but that doesn't cover everybody if you have some that are not vaccinated.
And of course, people out there may be wondering, well, how easy is it to get vaccinations? Well, we will tell you all about that when we come back on News Extra. And we're back today on News Extra. My guest is Paulette Schnell, the Regional West Community Health Director at Regional West Medical Center. Thank you very much for joining us today.
Glad to be here.
We've been talking about childhood diseases and the unfortunate comeback in a lot of those with measles, mumps, whooping cough, and the ability for you to actually protect yourself and your family through vaccinations. Vaccination is very easy to get taken care of, and actually, even if you're a person of lesser means, there's still the ability to do this.
Right. We have several programs that we can offer, and one of those is Vaccine for Children, and it's through through CDC and through the state of Nebraska, where anybody 0 through age 18 that does not have insurance or means to pay can qualify for the Vaccine for Children. So when it comes to routine vaccinations for children, there is no reason as far as financially why you shouldn't be able to obtain those. When it comes to adults, I want to talk a little bit about boosters, but even for adults, when it comes time for those vaccinations, if they don't have insurance, we have some different options for them that we work with them. So we have an adult immunization program that has a limited coverage of which ones we can give, but for those that don't have insurance. And like I said, in other ways, we can work with people so they can get vaccinated.
Well, when it comes to those boosters for adults, which diseases generally are we talking about?
Well, the one that we want to make sure everybody has had on board is at least one. It's called Tdap, and it has your tetanus and diphtheria, but it also has your pertussis for whooping cough. So if you haven't had that, which if you're an adult, probably past 30, you probably have not had the Tdap unless you went and got it specifically. But anybody who's having a baby, you'll hear from either the doctor will be talking to the parents about making sure they themselves have it, grandparents, anybody that's going to be around that baby. Because when it comes time, when someone has whooping cough as a child or a baby, it's usually from a family member that has gotten it and shared that with them. And so that's one of the boosters we want to encourage to make sure everybody has. And then sometimes people forget about their teenagers, maybe, for a while, because after 7th grade, they kind of may not be needing anything, especially if they're not going to go to college. They may not think about getting any boosters. So there's really some boosters around age 16 to 18 that they need to consider getting, and some new shots that they probably haven't had before. So really staying on top of things. It's not just get your baby in and get them covered and we're done. We need to think of our teenagers and then us as adults.
Is there a certain time frame for the frequency of needing to do those boosters? Obviously, it's going to depend on the booster itself.
Right, like our Tdap, and we tie that in, of course, with your tetanus. And so if you have had a tetanus shot recently and it did not have the whooping cough, the pertussis, we still encourage you, if it's your first one, to get in and have that, even if it's not been the full 5 to 10 years. But otherwise, for a tetanus booster with every 10 years is what's recommended.
Yeah.
Then, with kids, we're looking at age 16, there's some boosters that they should be looking at. And then also just educating those kids to continue on in their adulthood to get the boosters that they need.
Okay, so if somebody is wanting to get some vaccinations or boosters for themselves or their older children, how do they do so?
Well, there's lots of different options in our community. Within our office, Community Health, we see all ages and provide all travel vaccines and routine vaccines, and we also have some different programs that can help assist with people if money's a challenge. So you can call us. We have evening clinics that we can get you into and some daytime ones. So calling that 630 1580 is one of the best ways to get in. But if you have your own doctor and you've been going to see them, or there's some other clinics in the area, talk to them about vaccinations. Some carry them, some don't, but talk to your provider and make sure you're getting covered.
So vaccinations, especially measles, mumps, also whooping cough, very important, especially for youngsters, but there are a whole bunch of boosters that as an adult and as a young adult, your children may need, and something that will help protect not only yourselves but also the entire community.
Right, and that key basic series that you need is before age 2. There's 14 different diseases that are protected against by age 2, and a lot of those are in combined shots, but making sure that you're on schedule with that is real important because those babies don't handle infections as well as adults may be, so we want to really think about them in the long run.
All about protecting you and your family. Paulette, thank you very much for joining us on News Extra today.
Thank you, Scott.